Let's take a look at what's called somatic sensations. These are sensations that are due to sensory receptors in the skin, which are called cutaneous sensations, muscles, tendons, and joints, and also in the inner ear. There are four modalities of somatic sensations: tactile, thermal, pain, and proprioceptive. In this diagram, we can see a variety of sensory receptors that are found in the skin, and we're not going to discuss these now. These are covered in the lab. These tactile sensations include touch, pressure, vibration, itch, and tickle, and include a variety of tactile receptors, which again are covered during the laboratory time. Thermal sensations are picked up by thermoreceptors, which are free nerve endings. And there's two distinct types of thermal sensations, due to cold receptors and warm receptors. Cold receptors are located in the stratum basale of the epidermis, and you might remember that that's the lowest layer of the epidermis. And these cold receptors are able to detect temperatures between 10 degrees and 40 degrees centigrade, or in other words, between 50 degrees and 105 degrees Fahrenheit. Warm receptors, on the other hand, are not as abundant as cold receptors, and these are located in the dermis. And they are able to pick up temperatures between 32 and 48 degrees centigrade, or in other words, between 90 and 118 degrees Fahrenheit. Both of these kinds of receptors, both cold and warm, adapt fairly quickly. An interesting thing is that temperatures below 10 degrees centigrade and above 48 degrees centigrade primarily stimulate pain receptors rather than thermoreceptors. Pain sensations, of course, are for survival. They are protective. And the sensory receptors that detect pain are called nociceptors. They too are free nerve endings. And a term that you should know is the word analgesic drugs. Drugs such as aspirin or ibuprofen are analgesic drugs, therefore treating pain. An important concept related to pain is the idea of referred pain. Referred pain is pain that is felt in or just deep to the skin that overlies the stimulated organ, or in a surface area far away from the stimulated organ. In other words, referred pain is pain that you feel on the outside of your body, on the skin surface, but it's due to some sort of damage that's occurring inside of an internal organ. This interesting picture shows you a variety of locations where you can feel referred pain. And so what it's saying is that when you have pain on the external surface, it's due to damage that's due to an internal organ. Probably the most common type of referred pain is a pain that someone would feel when they're having a heart attack. They would feel pain in the left chest, but many times they will feel pain down the length of their left arm. Proprioceptive sensations are for the purpose of detecting the position of your body. And these receptors that are involved in proprioceptive sensations are called proprioceptors. And one of the things that proprioceptors do is allow your muscles to discriminate between various weights. If you're lifting a 5-pound weight versus a 10-pound weight, these proprioceptors can detect that. You also have proprioceptors in muscle cells that are involved in writing, and that's so that you can determine the amount of stretch and so that you can control the movement of those muscles very precisely. There are three types of proprioceptors, and these are called muscle spindles, tendon organs, and joint kinesthetic receptors. In the next few diagrams, we're going to look at muscle spindles and tendon organs. There are no pictures that relate to joint kinesthetic receptors. In this picture, we can see both tendon organs and muscle spindles, but we'll focus first on the muscle spindles. As you can see from this diagram, the muscle spindle consists of intrafusal muscle fibers, which are specialized muscle fibers that have sensory nerve endings wrapped around them, and also have motor neurons that innervate them called gamma motor neurons. The muscle fibers of your muscles that are not involved in the muscle spindle are called extrafusal muscle fibers. And they have what's called alpha motor neurons innervating them. So the way that a muscle spindle works, it's measuring the amount of muscle length, how much a muscle is being stretched. Messages are going from the muscle spindle up to the central nervous system, and impulses are also going up to the cerebellum, where that input is used to coordinate muscle contractions. The tendon organ is located at the junction of a tendon and a muscle. And the purpose of these is to protect tendons and their associated muscles from damage due to excessive tension. What would happen is if a muscle encounters a tremendous amount of tension, like if you were to lift a very, very heavy weight, the tendon organ would send a message to the central nervous system, and then a message would be sent back to the muscle. And what it would do is it would tell the muscle to relax, and that's so that you would drop the weight and not rip a tendon. Another type of proprioceptive receptor are called joint kinesthetic receptors, and these are found within and around the articular capsules of synovial joints. They consist of free nerve endings and also these Ruffini corpuscles that are also found in the skin, and these are responding to pressure. The Pacinian corpuscles respond to acceleration also and deceleration of joints during movement.